Hello, I'm actually not driving my car, which is kind of odd for me. Usually that's when I find I want to make videos, but I wanted to just make a new video because it'd been a while. I had my last surgery was the oophorectomy and I had the hernia removed. They did a DNC and I made a video something like 2 days after that and was pretty wrecked from that experience. And I think I calculated that was my 6th general anesthesia surgery, major surgery in a year and a half, something like that. So needless to say, that's a lot to go through and it really just knocked me down. I feel like I read that having general anesthesia surgery, major surgery, is the equivalent of being hit by a truck in terms of like what the recovery is like and what kind of trauma it causes to the body. So I definitely felt it. And I feel like I'm doing a lot better now. Today's the 10th of June and my surgery was on May 12th. Yesterday I went to Stanford and I met with my plastic surgeon as well, the medical oncologist. So the medical oncologist, basically they just want me to have a density bone scan, and that'll establish a baseline for me because she really wants me to go on the aromatase inhibitor as soon as possible. The oncologist where I live said, why don't you give yourself a break and like take some time off? I don't think 1 month is really gonna make that big a difference. So she's been pushing me all along to do everything like right now, take the tamoxifen. And I actually was able to ask her about tamoxifen because my understanding was that that could complicate and cause some of the bleeding that I dealt with a couple of months ago when I was in the ER for 2 days bleeding for 48 hours straight and needing to get 3 blood transfusions. Or was it 4? 3 or 4? I think it was 3. She's just been pushing me all along, which, you know, that's what they want to do. Her interest is to keep cancer out of my body, which I, of course, want that to be her interest. But there is a way that I have to sort of like, you know, balance out that I need a break. I need a rest. So I don't think I've talked about this. So I got a new juicer. I got this Kuvings. I'd never heard of Kuvings with a K. It's pretty expensive, but it's really nice. And I've been juicing. I started juicing every day and now I've been juicing every other day because I started to also research the spleen and like, okay, what's going on? If the spleen is what's killing the platelets in my body is attacking itself. That's what an autoimmune disorder is. What is going on with my spleen? How could I understand it a little bit better? And maybe what could I avoid? What could I do? And so some of the things I read about health for the spleen or cleansing the spleen was like not having too much cold food, not having too many vegetables and fruit, which I found kind of funny because I'm like, oh, here I am sitting here juicing vegetables and fruit, you know? So I cut back on that a bit. And also when I'm about to juice, I take whatever I'm going to juice that day out of the fridge for a couple of hours and leave it on the counter so it's not cold when I drink it. Yeah, so I've been juicing. What were some of the other spleen things? I don't really, I'm off of red meat, and I know there was a time I've made videos earlier touting raw meat, and I still think that there's a place for it. I also, you know, there's this carnivore diet. I've done that for a little bit, which is just beef and water. I mean, I did that for a very short time. It's not like I ever really gave it a full go because you're supposed to do it for like 6 months. I just did it kind of half-assedly for a few weeks. But I believe in those things. I think they have a time and a place. But right now, what I haven't done is I haven't really done vegan or even vegetarian for a while. And I think all diets are good in the right circumstance, you know, the right season, the right time, whatever it is. And right now I feel like I need to detox like the extreme amount of anesthesia that I've undergone. I had my follow-up surgery or my follow-up appointment 2 weeks post-surgery with the gyne-onc who did the, who did the oophorectomy. And they got the pathology back and there's no cancer, no cancerous tissues, no precancerous tissues. I wasn't even thinking precancerous. They took out both ovaries and both tubes, and there were some cysts on the tubes that that I didn't know about, so it's good they took them out. They weren't cancerous or precancerous. something that I don't fully get. They have to drain some sort of fluid, and I don't even know where the fluid's coming from. I don't think it's my bladder. I think it's like other bodily fluid, you know. So they drain some fluid, and in that fluid were some calcifications. This is something they found under the microscope. It's not something that the doctor observed in any way. So, and the calcifications like very rarely can be tied to cancer, but they would have like come off the ovary, and they remove the ovaries. So he said basically all there is for you to do is in 6 months you get a CA-125, which is bizarre because I don't have ovaries, and CA-125 is for detecting ovarian cancer. So I have these ribbons on my curtain that are flying about. I get a CA-125, and then what was the other thing? There was one more thing, and I can't think of what that is right now, but it's just like the sort of basic thing that you would do to follow up in terms of imaging and like diagnostic tests that one would do after they've had a cancer diagnosis. So there's that. And then, yeah, so I felt good about that. I mean, I wasn't even really thinking like, oh, I need to see what the pathology is. I was more just like, please, can I recover from the surgery? And so, yeah, I've been going ahead and getting these NPlate injections. And actually, yeah, I have my little emoji Band-Aid. There's my belly button without I'm no longer an outie, which is so weird, but that's where they give me the NPlate injection. I'm gonna show my scars too I can't, the things too. I can do right here. That's the scar from the ovary, and then that's the scar on that side. They're so tiny. They have me up to, I think this week, 4 micrograms per kilogram of weight. So whatever that ends up being, I'm like 64 kilograms or something. And it can go up to 10 micrograms. My platelets are just still totally in the trash. They were 15, and then they were 13, and today they were 19. So they actually have gone up a slight bit. I'm getting like crazy bruises. This I banged, I guess that's my funny bone. I banged that on something, and it's a very weird looking bruise. It's so kind of pinpointed. I thought it would be more spread out. This was like a random bruise. Where is it? Can you see it? Oh, there it is. That was some random, usually they're quite big like that. And I mean, I have random bruises all over myself, but I did have blood in my stool, and I do have blood in some of the phlegm. And what my doctor had told me at one point is that that's not surprising, given that like the capillaries, it's very easy to basically like pop a blood vessel for me. Having a bloody nose is not really that worrisome. Blood in the stool was a bit of a worry for me for sure. But again, that can also be tied to ITP as well, the low platelets. What is that? I don't know if it's on my face or on the camera. I think it's on the camera. Oh my God, I didn't know I could adjust the light. The things you learn when you have an iPhone. The only other thing that I wanted to talk about and share was that I've been doing research all along. Always on these videos, I always talk about how, I mean, the amount of hours that I've had to dedicate to understand everything I'm going through, because nobody is really seeing the full picture. Logical oncologist, the medical oncologist. At one point, I had the skin oncologist people, dermatology. Couldn't think of that word for a minute. Who else? Everybody's basically a specialist in their field. And, you know, and then I had the hematologist and, you know, so like that. But nobody's really kind of like looking at the whole thing. And the thing is also that I haven't had a primary care physician for a long time. So I'm about to establish that person who came highly recommended, and I hope that I really like her. I have that appointment in July, so that'll be good. Hopefully she'll be a little bit of my like, you know, general manager or whatever. She can help me figure this stuff out. But I did find that autoimmune disorder is linked to breast implant illness. I had somebody share information about that with me once upon a time, and I've also heard stories, and I mean, this is something I knew about, but what I didn't know was autoimmune disorder was linked to implants, and basically tissue expanders are implants. They're really hard. I mean, feels like having bricks in there at various points. I can't believe I've had them in for so long, it's insane. Once I found that out, that was one of the questions that I asked yesterday. Was I asked my plastic surgeon, who's quite young actually, so meaning that he probably hasn't had, I don't know how many patients he's had, but I asked him if he had ever removed implants and with the sole purpose of reversing the autoimmune disorder, and did he have it work? And he said yes, he had. And then I said, have you also removed implants and had it not reverse the autoimmune disorder? He said yes, actually far more in that category. So I mean, I really got my hopes up when he said that he had removed implants and it had reversed the autoimmune disorder. Even though I don't see really on the list thrombocytopenia, the platelet issue that I've been dealing with, I don't see that as being linked to implants. Still, it's just sort of like the whole world of autoimmune disorder. Various things can trigger it. I thought the infection and the antibiotics and all that was probably what triggered it, but when I looked back at my platelets, I saw that the platelets actually had gone down before that infection and before they kept me in the hospital and gave me all those antibiotics. So it's possible, like the surgery was in November, late November, and then my platelets were low in February. Not only that, like the platelets were low, but I started out with something they were calling red breast syndrome, and on this side, which has been the non-problematic side, this is the radiation side, this is the cancer side, this side had that red breast syndrome right off the bat. You know, it was some problem, and it resolved itself, but they did give me a bunch of antibiotics. I forgot about that actually. That had nothing to do with the infection on this side that they then gave me a bunch of antibiotics for. So it's hard to say, you know, it's really hard to say. This totally could be related to antibiotics. I heard somebody who I respect say that it takes years for the body to recover from one cycle of antibiotics. And I don't even want to do the math on how many cycles I have gone through in the since I got these expanders in. So anyway, I had a conversation with my doctor about going flat. And, you know, plastic surgeons are in the business of doing reconstruction. They're not really in the business of doing deconstruction. So I thought I didn't really think he'd give me a hard time. But in the past, I feel like he did steer me toward, hey, you know, I think you're going to be happier if you do reconstruction, which is how much I've been through. He knows how much I've suffered. So I appreciated that he, you know, basically, can I even see myself with that? I asked him sort of just like, what are the pros and cons, and what would the scars look like, and like, how many drains would I have, and just all of those kinds of things. And I feel like this is what I need to do. Basically what I probably will end up dealing with is on this side, because this is the radiated side, there'll be some concavity. It'll be concave a little bit because this implant expander has been pushing on my body, and the fact that like some of it reverses, but as I read, it doesn't ever fully reverse. That's really lame that I've had to like not only suffer having these things in for so long, but now we'll have to suffer with the effect of like having it pressed onto my body all this time. So there's that. And then on this side, he said that there could be some asymmetry because it's just the way the flap is, the way the skin is. It's not like a piece of paper cutting with scissors on a piece of paper. There's a lot more, you know, it's just a lot more involved. It may not look like absolutely perfect, but all this like effort to reserve and preserve the nipples, I could care less about the nipples. I'm like, take it all away. So right now I've got this inframammary scar that goes like this on both sides, which is you know, ideal for having breast implants because you never see any of the scars. And then, so I'm gonna have like the scars that go like that, like a smiley face, and then they're gonna cut an ellipsis or elliptic, however you say that, like through the middle. I guess I could do it like this. I'm like doing it in space. They're gonna cut it from here and do like an elliptic or something and go like that, and then like push that all together. And so there'll be an incision like that. So I'm basically gonna have a smiley face and then lines going across like that, which should be interesting. And then over time, you know, the scars will start to fade a bit. So yeah, it's been a big decision. It's one I've thought about a lot over this whole time. And boy, You know, I always say this. I was just about to say, do I wish I would have made that decision previously? And my God, of course I do. And yet there could have been a part of me, there almost certainly would have been a part of me that would have wondered, like, what would it have been like if I would have proceeded with having a reconstruction and having breasts and going that whole route? Like, would I have been happier? And it's really great that I've gotten to come to this decision and know that I'm now making the right decision, because I've just gone down this like really hard path for so long. I feel good about that. I feel good that there's no way I could have made this decision a year and a half ago, because I hadn't gone through all the things that I've gone through. So right now, the hope and the prayer for me is that the platelet disorder reverses. These come out as soon as I feel strong and recover from this previous surgery, which I'm very eager to get these things out of my body ASAP. But I also want to make sure that I'm, I want to make sure I'm as strong as I can be. So I don't even know what that means. I'm going to have to ask somebody else what that means, and then just, marry that with my own feeling and see what the best course of action is. But believe me, I want them out ASAP and the platelets reverse, and I don't have to carry on with the stupid NPlate injection, and then I don't need to carry on with anything. Well, they want me to do the aromatase inhibitor, and most likely I will, but I haven't even really researched any of that. I just took a walk with a friend who is 20 years older than me, but she did aromatase inhibitor and feels like she just went completely crazy from it. Like she jokes that she was she was calling out to her dog and looking at her shoe. Like, that's how sort of out of her mind she was. And I can totally get that, because there's a way that I just feel like I keep making this joke that I've got post-operative cognitive decline, and that's an actual real thing. I'm not making that up, POCD, and I'm not attached to believing that that's how my state of mind will be forever, but man, do I, feel beat up from this process. I'm so glad I'm not 20 years older. I'm really happy I'm 45. In a way, I wish I was 35. It would be sad and unfortunate, but I know that I would be, strong. So my goal is to get as strong as I can, have the surgery, be done, get the platelets up, and really move on with my life. So